Hi, I'm Eunice Alibudbud from BSN-14 and I'm going to demonstrate the physical assessment for skin. Before I start the procedure, I would like to clarify two things. One, as you can see, my client is fully clothed, but in a hospital environment, the client would just have the gown on. Second, I would just focus on the extremities and lower extremities of my client, but in a hospital environment, you would assess for the chest, back, arms, legs, basically your skin everywhere. But again, since we're in a school environment, I would just only focus on some parts of her body. First, before starting the procedure, we would first greet and identify our client. Hi, my name is Nurse Eunice. May I know your name?
I'm Alibudbud.
Good morning, Miss Olivia Alibudbud. Now, I'm going to explain the procedure for this physical assessment of the skin. Is it alright to inspect and touch some parts of your body?
Yes, you can.
Okay, now that we have the consent of our client, we can now do the hand hygiene. After doing the hand hygiene, we will provide the privacy that is needed for this physical assessment so that our client will be comfortable in this assessment. We'll close some curtains. After doing those things, we will now position our client comfortably. After doing those things, we will now proceed to the interview of any history of skin problems and as well as family history regarding the skin problems. Do you have any history of skin problems?
None.
As per your family history, do you have any family history regarding skin problems or any skin allergies?
Wala.
Okay. So as we can see, our client do not have any history and family history of skin problems. After doing that, we will now inspect for the skin color and the deformity of the skin color of our client. So as I can see here, her skin color seems to be in a perfect condition and her skin color seems to be normal. There are no tan lines, there are no suntans, and also I am taking a note of any signs of jaundice or cyanosis, which in the case of my client is not present of any. And now, I am now going to assess for any signs of edema. As I can see here, as I'm observing, I can note that there are no any signs or presence of edema in the client. Next, we're going to palpate and inspect for any lesions or primary lesions or secondary lesions for our client. As I'm seeing here, a mole is visible in her lower extremity part, which is just small, so it is not cancerous or it can not give harm to our clients. But if there are any abnormalities that you have saw in the assessment, it should be referred to the physician for further evaluation. Also, there seems to be a scar here. So may I know how did you get this scar?
That is from vaccine.
So this abnormality is from a vaccination. So this is a healed wound. So it will not cause any harm to our client. Next, we're going to take note or we're going to palpate for the skin moisture of our client. So as I'm expecting here, her skin moisture seems to be in a good condition. There are no dryness that I can feel, so it is perfectly fine. The skin moisture of our client is perfectly fine. Next, we're going to inspect or to palpate for the skin temperature of our client. So the skin temperature of your client should be warm, not too hot, not too cold. Also, in the assessment or in the palpation of the skin temperature of our client, it should be done by both hands to both parts so that we can assess for the symmetry of her temperature. So, as I'm assessing, Our client seems to be in a perfect condition. Her temperature is in a normal condition. And lastly, we're going to assess and to palpate. We're going to assess for her skin turgor. So in assessing the skin turgor, we're going to pinch her skin, and if it immediately goes back, then it is a sign that our client is hydrated. But if it does not immediately go back to its original position, then our client is dehydrated. But as we can see here, her skin immediately goes back to its original position. So, our client is hydrated. So, the last is the skin turgor. Now we're going to position once again our client comfortably. And we're going to inform her about the findings regarding the assessment. So, the abnormalities that I have assessed in this assessment is that you have moles and you have healed scars. So, if there are any abnormalities, once again, that may be harmful to the client, it is best to refer it to the physician for further evaluation. Next, her skin condition, her skin color seems to be in a normal condition, and the uniformity of her skin color seems to be perfectly fine. Next one, your history. You do not have any history of skin problems, as well as to the history or the family history of skin problem. The client is not present of those things. Thirdly, the temperature, the moisture, and the skin turgor of our client seems to be perfectly fine. And that's all for this procedure. We will now proceed to the hand hygiene once again. And we will document the findings regarding the assessment. So, report any significant deviation to the physician for abnormalities in the assessment of our client. And that's all for the physical assessment for the skin. Thank you for watching. Bye!